Thank you. Yes, there is a lot of innovation in the UK health system, and actually the organisation that I was working for, called NICE, has led to at least a 1% increase in the expenditure on healthcare, on new technologies, new drugs, new operations and procedures, because of the guidance that it's been given, even though that guidance is very much evidence-based, based on what is cost-effective, what helps patients, what is safe for patients. Well, I think that the contribution of CRICS8 will be very considerable, because it brings together a range of disciplines, from politicians and economists to technologists and people from clinical epidemiology, and of course health librarians and public health. And so it begins to help realize an understanding and a dialogue about what works, what is safe, what is a sensible way of introducing technology so as to bring the right kind of innovation in health systems. And I think that's very important in Latin America. Thanks. That's a very interesting question to me. I do not know very much about the health system in Brazil, but I think that there are many similarities to the problems that you face. In the UK, and especially in Scotland, we see some big differences in healthcare between the rich people and the poor people. Even though we have a nationalised healthcare system, in Scotland, less than 5% of people pay anything to get their access to surgery or drugs or to see a doctor. And that's because they choose to. It's more in the south of England, but very low figures in Scotland. I think it's a bigger figure in Brazil. But even though there is no barrier for paying for healthcare, we see that, for example, people having heart disease, it's much more common in those who earn less money, probably because of their habits, cigarette smoking, and so on. So I think that probably the differences in the healthcare systems they exist, but they're not as important as some of the differences in people's habits and their lifestyle. That is probably what really is the major determinant of health. And we see that in the UK as well as in Brazil. Of course, you also have some big challenges with geography here. You have some regions which are many hundreds or even thousands of kilometres away from the centre. We have a little bit of that in Scotland. We have some remote and rural areas, some islands, so it's a challenge to get patients from those islands, and increasingly we are using telemedicine, and there is a new Scottish Centre for Telehealth that I'm involved with, and that is bringing in new ways of being able to use video conferencing or other ways of stopping those journeys. If they're not necessary, let's not bring the patients to hospital, let's keep them at home, keep them out in the remote and rural areas. And I think you're doing that as well in Brazil and other countries of Latin America. So that's an important example of appropriate use of technology to support healthcare providers.